Good afternoon, everyone. On behalf of Work Package 6 leadership, we would like to welcome you and use those few moments to run through the Work Package 6 achievements, to showcase what each of the extraordinary partners we had, the value they created, the experiences they had, and the actual gains for you citizens they delivered. Let us start from the very beginning. The economic burden of non-communicable or chronic diseases is on the rise and is projected to show steeper increases in the future, especially in less developed economies and among the poor and middle and high income countries. The situation even gets worse when we are looking at multimorbidity, the co-occurrence of multiple chronic diseases or conditions in a single individual. Multimorbid patients are complex, particularly because they are more likely to have problems with mobility, self-care, and daily functioning compared to the patients with a single chronic disease, as well as cognitive impairment and frailty. This often results in a more challenging healthcare treatment, fragmented care, polypharmacy, which increases the risk of inappropriate prescribing, adverse drug reactions, or possibly poor medication adherence.
Patients with multimorbidity have complex health needs, but due to the current traditional disease-oriented approach, they face a highly fragmented form of care. Main objective of Work Package 6 was to implement an integrated care model for the care of patients with multimorbidity across 5 different pilot sites in Europe and assess in practice its applicability.
Our proposed model is focusing on different aspects of multimorbid patient care, not only related to clinical factors, but also to organizational factors, and includes components such as comprehensive assessment, case manager, individualized care plan, multidisciplinary team, and others. Integrated Multimorbidity Care Model aims to overcome the challenges related to fragmented care. The widely applicable model proposes 16 components for improved care of multimorbid patients. Structured approach supports care providers, improves outcomes, and aims to optimize resource usage.
We can now confirm that this can work in practice, and every member state can develop country-specific model versions fully adapted and specified for the local implementation based on CHRODIS Plus examples. It can bring benefits to all sectors, policymakers, provide evidence on effective interventions and that can represent the basis to inform policy stakeholders, provide a cost-effective intervention to be applied in different countries, and patients who receive comprehensive care centered on their needs.
Based on local experience and knowledge, participating partners determined integrated multimorbidity care model to the specific characteristics of their local healthcare setting and developed country-specific model version fully adapted and specified for local implementation. But for you to feel the different contexts and see the lessons 5 pilot sites have experienced, we invite you to a tour, a virtual tour, hosted by our local implementers in different countries. I'm eager to begin with the first one, the Integrated Multimorbidity Care Model implementation in Vilnius, Lithuania. Let's hear the thoughts from the persons who were directly involved in the process.
Why we attended this project was the main reason that our center has a lot of really complex and polymorbidic patients, and we have a huge concentration of problems to solve.
Aging populations and long-term care conditions means that the number of patients with multimorbidity is set to rise.
The main challenge is that it's the first time we are doing this. Nobody have done this kind of projects before in our center, so we have to build it from the ground. Our teamwork, we have a really strong team. We started our team building from the first day, and it developed from the administration of the hospital to our center, our family center main workers.
I think it was a very good experience for all of team members. The nurses working with specialists explain the patient about their diseases, teach them proper living as well as proper taking of the medicine.
Pradėjus dalyvauti projekte, pirmiausia buvo įsiklausyti ir mano orientuoti į mano sveikatos būklę. Man paskirtas mano atveju vadybininkas, įsigilino į mano sveikatos problemas, visas, kurios manęs rūpina, ir buvo, kas svarbiausia, visos iš karto sprendžiamos problemos, ne po vieną.
Helped to review demands of primary health care services and put a strong groundwork for future to national scale up.
I would like to thank Vilnius team for their huge efforts. I mean, wow! From theory to practice, from practice to pilot scale up, and hopefully from scale up to daily routine in every primary healthcare center. And now we will use the great opportunity granted by COVID-19 to travel in the other part of Europe in a few seconds. So, fasten your belts and enjoy your trip in Andalusia.
Para los sistemas sanitarios públicos significa un reto el abordaje y dar la mejor respuesta al elevado número de personas que presentan múltiples patologías crónicas. En este contexto, en Andalucía se puso en marcha el Plan de Atención Integral a Personas con Enfermedades Crónicas. En este entorno, el Sistema Sanitario Público de Andalucía ha seleccionado el componente de planes de acción individuales del modelo de atención integrada a la multimorbilidad.
Los planes de acción personalizados han constituido la herramienta operativa para la puesta en marcha del modelo de atención específico a las personas con enfermedades crónicas en Andalucía.
Una herramienta en la que los profesionales sanitarios, sobre todo los más cercanos al paciente, médico y enfermera de familia en atención primaria, junto con la persona enferma, junto con el paciente crónico, elaboran cuáles son sus expectativas, los objetivos.
Una vez que establecemos la comunicación o una reunión con el paciente y en muchos casos con el cuidador, lo que hacemos es marcar unos objetivos comunes para establecer un modelo de liderazgo compartido.
Los objetivos, las herramientas que se utilicen y los fines que se marquen en cada plan son necesariamente liderados por el paciente. Una de las herramientas fundamentales en el Sistema Sanitario Público de Andalucía es la existencia de una historia clínica informatizada única, compartida por todos los profesionales de cualquier ámbito, es decir, tanto de atención primaria como de atención hospitalaria, que refleja y recoge todas las actuaciones, todas las decisiones y la situación en cada momento del paciente.
total of 2,788 patients had been included and followed in the Andalusian pilot who had experienced an improvement in their perceived health status and show a reduction in the increment of unplanned, potentially preventable inpatient episodes. Compared to all chronic patients, those in the pilot have lower healthcare service utilization compared to the previous year, with a 23.5% reduction in the economic impact estimation. Quality assessment reflects areas of improvement in the elaboration of the personalized action plan.
La participación de la Consejería de Salud y Familia de Andalucía en el proyecto CHRODIS Plus ha supuesto una gran oportunidad de mejora que nos ha permitido compartir experiencias, implementar y evaluar el modelo de atención integral a la multimorbilidad.
Thank you, Carmen, Susanna, Inmaculada, Eva, and Ada for your presentation of Personalized Action Plan Implementation in Primary Care. CHRODIS Plus team had a chance to visit Seville a few years ago, and we were amazed by the enthusiasm and effort local team members are investing in the activities. Congrats with the great achievements. Let's continue our trip, and I think all of you will agree that the best stop for now can be Rome. The Multimorbidity Care Model in elderly with dementia and adults with intellectual disability program was led by the Department of Geriatrics of the Università Cattolica del Sacro Cuore in Rome. Let's watch it.
The pilot study we present has been implemented in a day hospital geriatric outpatient clinic in Rome, taking care of patients over 65 suffering from multiple pathologies. For their peculiar clinical complexity, we chose to enroll in the implementation at our site subjects with Alzheimer's disease and aging subjects with Down syndrome. At the end of the study, 265 patients with Down syndrome and Alzheimer's disease were included. The main objectives of the care model in our pilot site were to improve coordination of care and provide patients with a reference care provider, as well as to increase the accessibility of care through a techno-care service. We also wanted to enhance self-management through focus groups activities. From the first access, patients are met by the case manager, who would since then represent the main contact for patients and their relatives, granting an integrated approach to the care process. Patients with Alzheimer's disease and Down syndrome are assessed with the Inter-Eye contact assessment and intellectual disability tools, respectively. These are comprehensive assessment tools that include all functional and clinically relevant domains. After this first assessment, the patients receive a clinical evaluation with a geriatrician, who is then able to establish a personalized care plan. The presence of a case manager aims to increase accessibility to health care and improve continuity and effectiveness of the individualized care plan.
My main role as case manager is to guide and support the patient through the entire care plan set by the doctor. I connect with the GPs, plan the necessary exam, prepare the documentation to be submitted to the attending physician or to the multidisciplinary team if needed. I schedule the appointments and plan the visits based on physician indications.
Da quando c'è la case manager, la dottoressa Antonella, le cose sono cambiate di molto. Prendere appuntamenti, avere in contatto col dottor Garfi, quindi è tutto molto più semplice. Prima non si sapeva dove bussare, non si sapeva come, a chi chiedere, quindi le cose sono cambiate. C'è un punto di riferimento con la dottoressa. Prima non c'era nessuno, non si sapeva mai dove bussare.
Antonella è molto gentile. Mi accompagna sempre al professore, mi trovo bene, sogno bellissimo.
To overcome the logistic barriers, we introduced the use of techno-care platforms to improve the accessibility of care. making services more readily available or convenient for people with limited mobility, time or transportation options, improving communication and coordination of care among members of a healthcare team and the patient, and providing support for self-management of healthcare. Furthermore, to provide options for patients and families to improve their self-management, we decided to involve patients and families in the process of care by organizing focus group meetings.
The study showed that the implementation of the Integrated Multimorbidity Care Model had a positive impact on both professional and patient. We evaluated such outcomes based on key validated tools as well as PESIC and ASIC instruments administered in the pre- and post-implementation phases. This helped to demonstrate the clinical effectiveness of the care model, as well as highlight both the opportunities and the difficulties in possible adaptation of the multimorbidity care model in different countries and clinical settings. If not so, how?
Tutto è più facile.
Molto bene, grazie. Basta.
Prego.
Grazie mille. Hope you have also enjoyed the video. The time flies and we are back to Lithuania. This time let's see how colleagues from Kaunas executed the plan to implement the Integrated Multimorbidity Care Model.
We are in front of one of the biggest hospitals of Lithuania, Kauno Klinikos, and we made a pilot in our family medicine department, and we enrolled 150 patients in our clinic, and plus we involved 50 patients from very rural and distant areas. CHRODIS Plus and the Integrated Care Model values are very much in line with primary healthcare values, such as continuity of care, coordination, patient-centered care, and teamwork.
I would like to enjoy the results of the CHRODIS project in that aspect that we got an experience how to organize multimorbid patient care involving multidisciplinary staff at primary care and also involving consultants from the tertiary level, constructing case management, organizing a green line, easy access for patients to tertiary care. So in very close future, in these days, we are going to implement our experience, starting another one project for multimorbid patients in Lithuania, and we had partners from significant part of the Lithuanian rural sites, also involving tertiary care and secondary care hospitals, trying to implement telemedicine principles, trying to implement case management in our partners' family medicine clinics also.
Thank you, Professor.
The main benefit which I foresee from which project as a family physician and as a researcher is that we have established pattern of multimorbidity, and thanks to that project we can huge step further in multimorbidity research in new projects in future.
I was work with patients with multiple chronic diseases in the CHRODIS PLUS project, and I was performed a new role of nurses. It is case manager. individual consultations and individual healthcare plans for patients, consultations, and to improve patients' coordinations in primary health care between families, doctors and specialists, primary mental health and social care. And I am very glad that the patients recognized me as advanced nurse practitioner and found that case manager is very valuable.
Thank you, Ida, for a great recap. And last but not least, the pilot set from Aragon in Spain. The main aim was to decrease the impact of multimorbidity on health outcomes by increasing continuity of care and training healthcare providers in multimorbidity and patient-centered care. So please take a look how they did it.
Bueno, pues para el Sistema Aragonés de Salud participar en un proyecto a nivel europeo de este tipo siempre es una oportunidad de poder, lo primero de todo, compartir experiencias con otros países del entorno, que aunque tengan sistemas sanitarios que no son exactamente similares, pero sí que compartimos pues, aspectos importantes en relación con la forma de atender a nuestra población, ¿no?
CHRODIS Plus es una oportunidad de implementar un modelo diseñado en un contexto internacional pero teórico a la vida real.
El modelo diseñado por CHRODIS Plus es un modelo conceptual, un modelo teórico. Esto quiere decir que en sí mismo no es directamente implementable en ningún sistema sanitario. El paso previo es que los gestores y los planificadores sanitarios hagan un análisis de situación de su contexto sanitario específico. Para ello se suele hacer un análisis de debilidades y fortalezas, un análisis DAFO que pondrá de manifiesto cuáles son las áreas de mejora en nuestro sistema y en función de eso elegir y decidir qué componentes de dicho modelo finalmente podremos implementar o es factible y de qué forma operativizarlo en la práctica clínica.
Aprovechábamos esta primera entrevista para hacer una valoración integral del paciente, donde abordábamos no solamente la esfera física, sino también la esfera emocional y sociofamiliar.
La comunicación con nuestro centro de referencia, nuestro hospital de referencia, ha sido muy fluida. Nos ha permitido hacer interconsultas virtuales con el equipo que forma el hospital para determinadas patologías, evitar ingresos o incluso si eran patologías severas que requerían el estar ingresados aunque fuera un día, pues ha sido en 24 horas lo hemos resuelto.
Multipap es un curso de formación virtual que se ha diseñado en el marco de un proyecto de investigación, el cual nos ha permitido ofrecer a los profesionales sanitarios una formación específica en los aspectos de la multimorbilidad, la polifarmacia, la atención centrada en el paciente y la toma de decisiones compartidas.
Los resultados nos dicen que tanto la formación de los profesionales a través de la herramienta eMultipap, que proviene del entorno de la investigación, como la opinión de los pacientes sobre cómo se les proveen los servicios sanitarios, ha mejorado significativamente.
Con el programa CHRODIS, los cuidadores principales de este tipo de pacientes sabían que podían contactar con nosotros en cualquier momento, que estábamos accesibles, disponibles y que además estábamos para eso. Por eso el programa CHRODIS ha aportado seguridad, y cuando el cuidador está seguro y está tranquilo, pues esto redunda en un bienestar al final del paciente, porque es mejor cuidado.
Bueno, implementar este modelo en principio costó tiempo y esfuerzo, pero una vez implementado es fácil trabajar con este modelo. Para nosotros resulta fácil y práctico. Entonces, desde luego animamos a que todo el mundo se adscriba al modelo y que está funcionando. Nosotros consideramos que está funcionando muy bien.
Participar en iniciativas de este tipo como CHRODIS para nuestro sistema de salud ha supuesto un reto, porque ha permitido inicialmente pues, tener que formar profesionales, invertir recursos, dedicar parte de tiempo a seguir adelante con las iniciativas del proyecto, pero a la larga somos conscientes de que va a repercutir claramente en una mejora de la calidad de salud de nuestros pacientes.
with a great team, superb results. Like a cherry on the cake, it finished the presentation of our work package pilot sites.
Well, in general, I can conclude that 5 pilot sites with limited financial resources in CHRODIS Plus directly reached 3,740 patients and improved their care. They have secured better efficacy of the healthcare process, significant improvements on PASS plus scores. In addition to that, implementation led to permanent changes in practices, organization, and in participating institutions, and 3 out of 5 pilot sites confirmed further scale up after the joint action.
Local experts concluded that process initiated by this implementation could also bring long-term improvements in the care processes, such as optimization of current health utilization resources, improved quality of patients' care, improved access of healthcare services, and significant clinical outcomes of patients.
Motivated early adopters adjusted good practices to local healthcare needs, proved the concept, and prepared it for the scale-up. They showed how identified good practices could be converted into real life with a direct benefit for patients, the healthcare system, and even the whole country.
If at least one of aspects presented during the last 30 minutes would interest you, or you have some questions, please join the upcoming Roundtable Discussion 3, Integrated Care for Multimorbidity, What is Next? Moderated by our web package leader, Graziano Omar.